Based on my age and my number of eggs, what is my likelihood of having a baby? At least one baby, at least two babies, or three from my age and the number of eggs that I have frozen. This question led me to say, well, maybe there's a way that we could predict this for patients. Maybe there was a way that we could kind of figure this out. We took information from patients who were doing ovarian stimulation but did not have infertility, and we looked to see how they did, how many eggs they got, and the likelihood that that egg would become what we call a blastocyst in the lab. We then took information about the likelihood that that blastocyst would be genetically normal based on the person's age, and then assumed that if you put back a genetically normal embryo, it would result in a live birth about 60% of the time. And we used all this information, put it together to come up with a calculator to estimate the likelihood of having at least 1, 2, or 3 live births. This model was then published and then incorporated into a calculator on a group called MDCalc. And it is totally free for patients, for docs, for anybody who might be thinking about egg freezing, and can help you determine what your likelihood is of having a baby if you've gone through a cycle, and then what your likelihood of having at least 1, 2, or 3 live births might be if you, say, consider doing a second cycle. I think it's a really helpful tool just to give knowledge about the egg freezing process in determining what they might want to do moving forward.